Hi, in today's case, I'll talk about a patient who suffered from pain both in his right arm and his left knee, and how he could treat all of this with just one needle. If you've been following the channel, you probably know that the balance method is one of my main approaches in acupuncture, and one of the reasons that I love the balance method so much is because of its efficacy. We know that we can treat most cases of pain with instant results, but also the efficiency with which we can work. Generally speaking, the balance method will allow us to use a lot less needles than most other methods. And the case that I bring you today is a particularly good one to showcase this efficiency, because I'm going to show you how with one single needle I was able to help the patient with two different pains. If you'd like to learn more about the balance method, check out the courses I have available in the links below. I have courses both in English and in Portuguese. Today's case is about a 79-year-old male patient that came to the clinic with a main complaint of pain on his right elbow. This pain had been developing for over 2 weeks, and it had been increasing in intensity, and now it was starting to cause him problems to do most movements with his arm. When he was walking to the appointment room, I saw that he was kind of limping. So I asked him if there was anything wrong with his legs, and he said that he had a nagging pain on his left knee. It was not too severe, but it had been there for a long time. He couldn't remember exactly when it started, but he said that he could manage it, but that it bothered him, and that a lot of times he had to take medication for it, but that his main concern was the elbow. But I told him that probably we could treat both in the same session. So let's analyze the case. As I told you, this was a 79-year-old male patient, and the main complaint was pain in his right elbow. As a secondary complaint, we found out there was also pain on his left knee. In order to apply the balance method, we have first to determine the affected channels. So, inquiring where the pain was and palpating the area, I found out that the main focus of the pain in his elbow was on his heart channel. And looking at the knee, his pain was mainly on the inside of his knee, and after doing some movement tests and some palpation on the area, I arrived at the conclusion that the main affected channels were the spleen and also the liver channel. So as you see, we have at least 3 affected channels: heart, spleen, and liver. At a first glance, this might look like a complicated case to solve. We're working in 2 different areas of the body, and we have 3 different meridians affected. So a more novice approach could be to try and do one balance for each of the affected channels. But as I told you in the beginning, one of the hallmarks of the balance method is efficiency, the use of the least number of needles possible. So what I did in this case is something called a matrix, and I'm going to show you how we can apply this. First of all, we have here the balance method table that you all know by now. And the first thing we have to do to apply the concept of the matrix is to reduce this table and keep only the lines referring to the channels that we have as affected channels. So in this case, we end up with a table with 3 lines regarding the spleen, the heart, and the liver channels. And now what I'm going to do is I'm going to search this smaller version of the table and see if there are any channels that repeat in different lines. And as you can see, as we look around, we see that the small intestine will treat the spleen, it will treat the heart, and it will also treat the liver. This means that the small intestine channel will be able to treat all 3 affected channels. This is great news for us because it means that we can use only one channel to treat all the points of pain that the patient complains. Now we need to decide on which side we're going to apply the treatment. As you can see, the small intestine treats the heart by system 3. If you recall, system 3 is mandatory opposite side, and it treats the spleen and the liver respectively through system 2 and system 4. On these systems we can treat on either side. So what I decided to do was treating the left side small intestine, so it will treat opposite side for the heart and same side for spleen and liver. If you think about the images, the affected areas are the elbow and the knee. Both of these areas can be treated on the elbow. So what I did was doing a direct mirror of the right elbow on the left elbow, and the same thing on the left elbow to represent the left knee. So we have determined the channel that we're going to use, and we have determined in which area we're going to apply the needles. Now all we need to do is find acupoints. So if we look here, we have our small intestine channel, and all I did was palpate for acupoints around the area of the left elbow. Through palpation, I found a point that was very painful on the patient close to small intestine 8, and I needled this point fairly deep. After this, I asked for the patient to do some movements on his right elbow, and there was instantly no more pain. After this test, I asked the patient to stand up and walk around a little bit, and the patient said that there was no more pain. He still felt something different on his knee. He wasn't limping anymore, but it still wasn't moving 100% like the right knee, but the pain was gone. So I sat the patient again and I left the needle for half an hour. After that, I removed the needle and asked the patient to test again his right elbow, and it was 100% okay. And then I asked him to walk around, and the patient said that there was no more pain, no more limping, and now he didn't even feel the difference that he was feeling in the beginning. So it was exactly the same for his left and right knee. And this was the treatment for this patient. As you see, one needle to treat 2 different types of pain and 3 different channels. This case is still not over. I saw the patient this week. He's coming back next Monday, but it is going fairly well so far. This case showcases for me the reason why every acupuncturist should learn the balance method. We see all the main selling points of this method. First of all, a very direct diagnosis. Where does it hurt? And locate the channels. Then we see a very direct and efficient way of choosing points, and a great result with the patient leaving 100% pain-free with just one single needle. Of course, you won't be able to do this on every case. Sometimes you don't get 100% relief. Sometimes you have to use 3, 4, 5 needles for the same kind of pain. But in almost every case, you'll have quicker and better results than with other methods, and also you will use less needles. This is important for a number of reasons. First of all, it's more comfortable for the patient because you have to stick less needles in his or her body, and particularly in cases like this with a very old patient. He was 79 years old. His body is very frail. There's not that much capacity for the body to respond to different stimuli. So the least number of stimuli that we apply, the better the results are going to be. So especially for older patients, I like to use as few needles as possible in the same treatment. Thank you so much for watching this video. I hope it was helpful to you. Don't forget to like and subscribe. Also share it with your contacts so they can learn more about how acupuncture can help them too.